Hello, my name is Eleana Molina, and today I am going to talk about my capstone project for this class. My project will attempt to address the impact that hospital readmissions due to heart failure have in a healthcare organization and in patients' outcomes. The proposal will be delivered from the perspective of a health maintenance organization, HMO. During my years of experience, I have learned that hospital readmissions are one of the costliest episodes impacting the healthcare industry. One of the leading causes of hospitalizations and readmissions is heart failure, Zayanan and Fonaro 2016. Preventing this issue has become an increasing priority for clinicians, health insurance companies, as well as federal and state-sponsored programs like Medicare and Medicaid. There are many strategies that have been developed to reduce hospitalizations and continue to be implemented to improve these outcomes. Sayanan and Forano 2016. In order to assess the need for this project, I reviewed the existing data together with my mentor that exists regarding this topic. The data confirm that a high rate of hospital readmissions due to heart-related symptoms can impact a health care organization financial status. According to data from the Centers for Medicare and Medicaid, 20% of patients with heart failure are readmitted after 30 days of discharge, and the estimated length of stay for each readmission is about 6.4 days. The estimated cost is around $10,000 per readmission. Many programs have been implemented to decrease readmission rates. One of them is the Hospital Readmissions Program, HRRP, which was launched in 2012. Since implementation, this program has helped decrease admission rates by 8% during 2012 and 2015. McLavena, Eben, and Allen, 2015. For this project to be successful, it requires the participation of many stakeholders. From the perspective of a health maintenance organization, the individuals that will be directly involved and impacted by this project are the nurses and care managers who will coordinate care transitions following a discharge, the physicians or medical directors who will need to coordinate care among other providers and approve medical services or deny medical services, the human resources and the finance department to support the logistics, the regulatory and compliance department that will oversee that the decisions follow the appropriate laws and regulations, and of course the patients whose involvement and cooperation are crucial to the success of this initiative. The main goal of my project, or the main goals of my project, are to implement a program that enhances transitional care and patient engagement as a way to reduce the cost of hospital readmissions for heart issues, while at the same time improving patients' health outcomes. As with many other initiatives, it is expected that this proposal may face unconditional support from some of the stakeholders, as well as resistance from some of the groups that may find the proposal too expensive or unachievable. There will be probably others who will be a little skeptical but will be watching with interest. Among those who are expected to support the project are the nurses and care managers whose role is fundamental in executing the proposal. The role of care managers is becoming more and more important as organizations put a lot of emphasis on predicting factors relevant to care delivery and outcomes. Haggerty et al., 2003. Those who may oppose the project could be the medical directors or peer reviewers who may feel that there are many other chronic conditions that require follow-up and that there are very few resources to dedicate to only one disease. To this group, we will need to bring awareness to the statistical facts that indicate that patients with heart disease have more chances of being readmitted, and that by dedicating additional resources to the disease without neglecting the others, we may be actually improving the company's financial situation and also improving the lives of this population. Finally, even though in the beginning the patients may not be that optimistic about the benefits of this program, as long as we keep them engaged and they see the results, they will be more confident about managing their own health condition and cooperating with the physicians, nurses, and care managers in their ongoing care. The baseline will help me measure my project and how I am going to deliver it. These are some of the items that will be considered as part of the baseline. The amount of patients impacted by heart failure that we have in the organization chart, data analytics to identify the patients that are at a higher risk for readmission after discharge, a financial impact analysis, resources that will be allocated to this project, internal metrics that will be measured, and an internal management risk assessment. References.